Good afternoon, and welcome to the Canadian Housing and Renewal Association's webinar, Rural Homelessness Estimation, When Counting and Guessing is Not Feasible. My name is Dominika Krzeminska. I'm the Director of Programs and Strategic Initiatives here at CHRA, and I'll be your host for today. Thank you all for joining us. Moving on to today's webinar topic. Rural homelessness rarely presents the same way as in urban areas. Consequently, data on rural homelessness is extremely limited, and communities are often met with disbelief when attempting to address local homelessness issues or determining housing need. Today, we will learn about the first ever step-by-step guide to estimate rural homelessness and see results from the first few pilot studies. This guide has already been applied in more than 25 rural communities across Canada. This webinar presentation will give you enough knowledge to apply this guide in your community and to gather the data necessary to inform homelessness issues and resolve them. I now have the pleasure of introducing to you our speakers for today. Zane Abedin is the Alberta Rural Development Network's Community Development Manager, a unique position that works in consultation with rural communities to identify issues and develop strategies to provide solutions across all ARDN's initiatives, especially housing and homelessness. He has authored the award-winning guide to estimate rural homelessness in rural communities, Step-by-Step Guide to Estimate Rural Homelessness, which is now being adopted by communities and provinces across Canada. Lynn Bossman is a case manager and community development coordinator with Spruce Grove Family and Community Support Service. Her work has centered on case management using the Housing First philosophy. She has worked on such projects as Pathways Home, the Spruce Grove Strategy to Reduce Poverty and Homelessness, and the Tri-Region Homelessness Estimation Project. Sharida Chileg is a Community Development Coordinator with Stony Plain Family and Community Support Service and works on the Poverty Reduction Initiative in Stony Plain. This includes such projects as Cultivating Communities of Abundance, Neighbors Meeting Neighbors Community Supper, and the Tri-Region Homelessness Estimation Project. Spruce Grove and Stony Plain Family and Community Support Service offices often work collaboratively to address issues that affect the Tri-Region community. Welcome, Zane, Lynn, and Sharida. Zane, I'll now pass it over to you.
Give me just 1 second, I'm setting this up. All right, thanks Dominika for introducing us, and good afternoon everyone. Thanks for inviting us, and thank you for attending this session. So basically, just to give you an overview, my name is Zane Abedin. I'm the Community Development Manager at Alberta Rural Development Network. To start off the presentation, I am just going to give you an overview of ARDN. What are the different initiatives we work on, and why did we even decide to actually develop an estimation guide for national, for basically Canada, since we are an Alberta-based organization, how we developed it, why we developed it, and what the guide is. Following that, we will also present a few practical applications of the guide, and then Sharida and Lynn are going to go through the process they followed and the guide they followed in order to gather the data for homelessness and housing in their community. So ARDN is a not-for-profit organization founded in 2009 by 21 Albertan post-secondary institutions. Essentially, ARDN's core purpose was to use the combined expertise of Alberta's post-secondary institutions to support rural development in Alberta and to help communities grow through research and learning. ARDN was basically formed to address community development initiatives in rural communities. And ARDN works as a project facilitator by providing innovation solutions, supporting new partnerships, and leveraging existing resources. So again, the core purpose was to essentially act as a facilitator to use all our resources and provide them to rural communities, like a middleman. And ARDN strives to be Alberta's premier rural development organization. So as you know, we have always been strive to be focused on Alberta, but now we're actually evolving, and the estimation guide itself has been actually developed for rural communities across Canada. And I will go through some of the initiatives as well, which will give you an idea of why and how we are evolving to potentially work with communities across Canada. So these are some of the college members, post-secondary institution members for our organization, and some of the partners and collaborators without whose support we would not have been able to be here. So Airdens, so these are some of the initiatives we work on. We have a Canadian Rural and Remote Housing and Homelessness Symposium that we are hoping to hold every year. The first one was held in October, and I will go on each one of these in a bit more detail in the next couple of slides. We have a sustainable housing initiative where we help rural communities develop affordable housing by helping them access funding to build housing. We have an initiative called Homelessness Partnering Strategy. Under this, we manage HPS funding for rural communities outside the 7 big cities in Alberta. And this funding is used to support housing and homelessness issues in the various rural communities. Then, as we are here for the homeless estimation, that has now become an initiative for us. Alberta Rural Coalition on Housing and Homelessness, we call this Art Squared. This was developed. To basically bring all the different organizations and communities together on one platform to address issues or concerns they're having and provide solutions to actually address those concerns. Then we have a rural community opioid outreach program. This was a funding that we received to create awareness of opioid in rural communities. So as I mentioned, Canadian Rural and Remote Housing and Homelessness Symposium. The first one was held in October 2018. We had 250 plus attendees. We had representation from all across Canada, and the attendees who attended this session basically said nothing like this we've ever been to anything like this, and the learnings were tremendous. Something that we can actually go back and apply. We are hoping to hold the second symposium in the second quarter of 2020. Essentially, we're moving the dates out because there were too many presentations, conferences on the October-November timeframe. As I mentioned, the Sustainable Housing Initiative, through this, we help communities access funding by doing the pre-development work to develop affordable housing. Currently, we're in the process of developing affordable housing toolkit to help communities develop affordable housing and go through the process of developing affordable housing. This is again something that we are not only limited to Alberta, but we're also trying to work with other provinces. This is just an overview, just to give you an idea of what we are doing. Again, homelessness partnering strategy. We manage the HPS funding for rural communities outside the big 7 cities like Calgary, Edmonton, Lethbridge, Medicine Hat, Red Deer, Fort McMurray, and Grand Prairie. So anything outside those cities, we manage the funding for that. Currently, we're in the process of getting new funding for the next few years. Opioid outreach program. This was a partnership with 13 organizations across Alberta to create awareness, opioid awareness. And we have been having education sessions since July of 2018, and they'll run till March. If you guys need any support, we are always there. Please feel free to contact us. So now to the step-by-step guide to estimating homelessness. So Arch Squared, as I mentioned, was actually developed to address concerns that rural communities are facing. And one of the biggest concerns that came out of this was that rural communities do not have enough data to gather support or to provide support to the people in need. There is limited data is not available, and there should be a way to actually generate or gather data so that we can create awareness and bring potential support to the communities. So through this Arch, we actually came up with the idea of step-by-step guide to rural homelessness estimation, and we applied for funding with the federal government and received some funding to actually create a solution to gather data to address housing and homelessness issues. And so we came up with the step-by-step guide. This guide, we worked over 3 months after we received the funding to develop the guide with communities and organizations across Alberta. Mostly, we had a few communities from other provinces as organizations from other provinces as well. However, we were still Alberta-based organization, but now we're evolving into. We're actually, because this document is more based towards the national for across the nation, so we're getting more traction now and more involvement. Essentially, this was developed due to limited data in rural communities, and we call this a living document. So I don't want to say that step-by-step guide is an instruction manual or the guide you have to follow in order to estimate homelessness or gather the data. We call this a living document because, as you all might know, that every rural community is different. Rural communities have different demographics, different ethnicities. Everyone has a different way of running their community. So there's no one standard method that can be applied. So this is a living document, a starting point which organizations or communities can use to gather some kind of data. And that's what the whole purpose is, to basically start something. And if you read the guide, if the steps make sense, follow it as is. If not, then you have to customize it. And I will go through a sample community that we customized this entire guide because the community was unique. This can be easily downloaded from our website in English and French, and is developed for rural Canada. So the project itself was to develop cost-conscious, efficient, and reliable practices to estimate the number of homeless individuals in rural Canada because there was no data. We've spoken to people in the past about homelessness in rural communities, and they've said, "Oh, we were not aware that there's homelessness issue in rural communities." These are people who should know about the concerns, but they don't because there is no data. There's nothing around. There's no information around this issue. So something had to be done. And why it had to be done? Because rural and urban homelessness is interdependent. So currently we do point in time counts in urban centers. We know the numbers in urban centers, but we don't know any numbers in rural communities. Because no data is available, there is no support to rural communities. So what happens is the people who are in need or require support actually move to urban centers, which creates a pressure for urban centers and they are unable to address the issues in their communities. Essentially, what we've learned is there should be a way to actually limit the people at the point of origin or provide support to them at the point of origin so that they don't become someone else's problem. And in order to do that, we have to prove that there is a need. If we prove the need, then we can actually provide support, right? So it was a huge concern. It was a huge need. So we thought, okay, let's start this. So when we looked at it for the first time, we didn't want to reinvent the wheel. We wanted to see what's already there in the community or in Canada being applied. There are two methods. Point in time count, all of you guys are aware of this. Population estimation, this is not readily used in Canada, but so we started looking into these two methods, and we all know point in time count is count sheltered or unsheltered homeless in a single night. Volunteers basically go around town, find people and conduct surveys, and then use all of their data to develop strategies and implement resources. However, that is what happens in urban centers. But the situation the picture completely changes when you move the same point in time count method to the rural communities. Because rural communities are different. They're not urban communities. They have limited resources. They have logistical challenges. They're far and wide. How will the volunteers actually walk around town to actually find people? They have data and statistical analysis limitations. The population of rural communities is different. it is not, they don't have the same capabilities as urban centers. The urban centers don't have the same capabilities as rural communities. So the talent pool is different, things are different, and the point in time count does not work for rural communities. And we realized that there was definitely a need for something more customized. So we moved forward, but we did not really. So before stepping into population estimation, I want to mention that point we did not really eradicate that, or assume that point in time count does not work completely. We just think that it has to be adapted and customized for those communities. And I just want to highlight that our estimation guide was we actually made sure that point in time count was like the basis of our estimation guide, but a customized form. So again, we looked at the population estimation, and according to population estimation, what they do is they estimate homeless population based on the data from service agencies. So essentially, over a period of time, whenever people come in to access services in service agencies, they are asked to complete surveys. And over a predefined time frame, they complete services, and at the end, all the surveys are gathered, and they estimate, okay, there are 150 people in the community that are in need, that need support. So that's an estimation, right? So that's what they do in population estimation. However, when we were evaluating this population estimation, we quickly realized that there can be we can actually face duplication by doing population estimation, because one person can essentially go around different service agencies and gather data. And do the survey, and that way they would be duplicated multiple times, and that would falsify the data itself. So we somehow combined the population estimation, and we thought point in time count was a good method, but just not completely applicable as is to the communities. So we combined both of these methods and introduced a new variable, a unique identifier, and created a method called service-based estimation. So the step-by-step guide is actually based off this new method called service-based estimation. I just want to name it something. So in this method, the number of homeless using service agencies for support over a period of time are asked to complete a survey. However, when we were consulting with other communities, they said, but we already know there are certain areas where there are people who are in need staying. So how do we become proactive to actually capture that data as well? So we thought, okay, so why not? So we are anyways doing these surveys in the service agencies when people come in to get service. Let's just, if we already know that there are certain areas, let's just go there and do service as well. So we said, okay, additionally, if the community has enough resources, then estimate the number of homeless in known locations as well. Then we said, okay, as I mentioned previously, based on the the population estimation, there can be duplication. There can also be duplication when the communities try to be proactive and go and survey people in these known locations. It is possible that one person gets surveyed in this known location, and then he goes and accesses services, and then they fill up this other survey. So in order to reduce all that duplication, we thought we should come up with something that basically helps us anonymously track these people, where it does not tell us who these people are, what their names are, what their information, anything. Keeps them completely private, but we can still ensure that there's no duplication. So we created this thing called unique identifiers. Essentially, in unique identifiers, we basically said the first two letters of the first name, first two letters of the last name, sum of numbers in the birthday, last two numbers of the year of birth, and the gender would actually create something like JOSM660M in this John Smith's case. Now, it is close to, and we have gone through the rigorous testing with this, and it is very hard to actually figure out who this person is. So it keeps the person completely anonymous. But what happens with this unique identifier is you can essentially keep this on file. First of all, it reduces the duplication. Secondly, you can keep this on file, and over the next few years, whenever you do estimation, you can actually revisit your previous data and track GOSM 660M and see what kind of services this GOSM 660 has been using over the past few years. And if this person has been accessing services over the past 10 or 15 years, why is this person not back on the feed? What is wrong with the services that are being offered by our community? Essentially, you can use this unique identifier to address gaps in your services, right? It is possible there's something that needs to be improved, and that's why this person has been basically moving around and not being able to get back on their feed. So it's a very good tool to track things. We did a presentation in Housing Central in 2018, in October, November, in BC, and I made the conference attendees or the people who were attending our session to do a mock estimation, and they created these unique identifiers, which I think is pretty interesting to see, because it was essentially, we tried to guess at the conference. It was hard. It was a little hard to guess who is, and we knew most of the people there. So it's just an interesting slide to see. So now that's how we started. That's how we developed the estimation guide and why we developed it. Now what it is essentially a very simple 11-step method to estimate homelessness. And step one is to establish a task force. As we said, service agencies have to be involved because we want to limit first of all the cost, and basically because we have limited resources, we want to reduce the cost. Essentially, we've estimated that using this estimation guide, you can actually conduct an estimation in a community for about $5,000. So step one is to establish a task force, make sure all the service agencies who will participate are on the same platform. Understand the definition of homelessness. We are trying to address this on a national level, and if the definition of homelessness is different across different organizations and communities, the data becomes invalid. So step two is to understand the definition of homelessness and have a standard definition across the board. Step three is assign a representative. Someone has to do all of these things. We can't just do on the side of our desk. And the cost of $5,000 essentially pays for this representative. Then step four, training. The representative has to train the task force. They have to be on the same board. They have to understand the main purpose behind this estimation. Step five is marketing. The community has to be on board. The community has to understand what the needs is. So one thing I want to mention here, and Sharida and Lynn are going to present on their presentation, is that when we were talking to Sharida and Lynn, they basically, when they promoted their estimation in their community, they didn't say step-by-step guide or to estimate homelessness or we're trying to estimate homelessness. They basically said, we are trying to do housing and service needs assessment, which got them more traction instead of homelessness, because when you mention homelessness, it has a negative connotation. And we have had communities where service agencies decided not to participate because they said it was not something they were interested in. So we are currently in the process of updating our guide, and we'll be including new terms and references to actually market. Training is important because, again, these people are trying to do this on the side of their desks. We have to explain service agencies that if we get all of this data, we will be able to increase support, which might actually help you hire more help, provide support to the people you are serving already. Step six is estimation. You do this estimation using the guide or the survey provided over the course of a month. Step seven is data entry and analysis. Now, of course, the representative does this, or you hire someone else to do this. And while the analysis is being done, you actually gather feedback. So step eight is getting feedback from the service agencies, the task force that was involved in estimating homelessness. And the reason we do this while the analysis is being done before the reporting is to understand what are the pain points so that we can prepare ourselves better next year. It is possible this year if you use the step-by-step guide and as is, you think it worked really well, but the service agencies had a lot of concerns and issues. So you, in step 8, you basically gather the feedback before even the results come out, so that next year you can adapt the step-by-step guide and create a customized method. And obviously you report everything. If you use a customized method, you have to report it so that you can basically create a buzz around the issue, right? Step 10 is access resources. So once you report it, we shouldn't like just sit on it that, oh, someone's going to come and help us. We have to create our own, like we have to create the issue. We have to create a need and we have to address the need ourselves as well. For example, the reason we have step 10 here is people usually do a press release and say, okay, this is done, we're happy, someone will come and help us. No, they won't. You have to help yourself. So just to give you an example, should Access Resources or other organizations that are involved in doing things, I can't think of an example, but I'll just take ARDN for now. So ARDN helps communities develop affordable housing. We help communities access funding. So if in your estimations you figure out housing is a huge need in the community, access resources like ARDN to use that data to address the need and access funding, because you have to create a case. You can't just sit with the data. And then repeat this process every other year or 2 years, 3 years, depending on how you want to do it, to basically figure out and create the trends and figure out how you can actually resolve this concern in the community. This is what the estimation survey looks like in the guide right now. But after doing these pilot projects, we've learned quite a bit, and we are currently updating our guide and hoping to publish this guide in April 2019. And that will have a revised survey as well. It's a bit longer, but it has more information. So in this presentation, like while I was presenting, you must have already realized there are a lot of benefits in knowing the numbers. You can direct public attention to the homelessness issue. You can inform local, provincial, and federal policies. You can improve the service agencies' programs and address the main concerns that are being faced by the community. It is possible by doing the estimation you realize that mental health is a huge concern, but you don't really have any support in the community, so you can basically create that support and provide that support to the community. So this was all about the guide. Now, just want to step into the practical application. So I want to show 3 samples here. So one of them is Rocky Mountain House. Immediately after we launched the guide, we wanted to do a comparison between point in time and estimation guide. So we did that in Rocky Mountain House. Then the Conklin is an example of a unique community that used a customized method, basically adapted the estimation guide. And then Spruce Grove and Stony Plain were part of another project that I will talk about, and Sherda and Lynn are going to discuss that in more detail. So after the guide was published, we thought, okay, let's do a comparison in a community. Since September of 2017, we did a point-in-time count in Rocky Mountain House. 2 out of 11 surveys were conducted, determined that there were 2 people unstable. And they used 700 volunteer hours. This is not all the information, because while they were doing the point-in-time count in Rocky Mountain House, they got snowed out. So essentially, this data could be much better if there was no snow, but because they got snowed out, we won't be able to do 11 surveys. However, the main concern that I had when I looked at this was, why are you spending 700 volunteer hours for this, even if it was it basically got wasted, right? So there's a lot of effort and resources that go into point-in-time count. Then we did the estimation at the same time. We found that 44 people out of 57 were in an unstable situation, which gave us more data. And the data that you see here, 39% due to mental health physical health. Similar data can be gathered from the point-in-time count. Essentially, the only thing that is different between these two methods is the way the data is gathered, right? And so this is just a sample of a comparison, but we are hoping to do another comparison and we'll try to do this in the summer next time to make sure that we have a fair comparison. But with our version 2, we will be doing this. So Conklin was a customized project. In the summer of 2018, Conklin is a small community near Fort McMurray, and they wanted to address housing issues. But in order to address housing issues, they wanted to gather some data. So they approached us, they looked at the guide, and they said, our community is very different. We don't have permanent service agencies in our community. The guide does not really apply. What can we do? So we helped them customize the survey and the steps of the guide as well. Essentially, it's a living document. You can use that as a starting point, but you can modify things. Based on their StatScan data, said that they had 185 people in the community. Their municipality said around 375 people. So again, right off the bat, we can see there's a huge discrepancy. So they were not sure what was happening in the community, and this had to be done. We did, so the customized method involved door-to-door service. So we did 54 surveys. This was a little expensive than the $5,000 because they had to essentially do the door-to-door surveys. They found 92 individuals were in an unstable situation due to inadequate housing supply. Unemployment was a huge concern, and 35% were vulnerable residents between 1 and 20. So there were a lot of inconsistencies in national census and the municipality. So this had to be done, and that can happen in any of the communities, right? So this actually estimation guide helps you realize what really is happening in the community as well. So those were the two projects that we did. Then we applied for a funding with the federal government to actually apply this guide in a number of communities across Alberta in partnership with the FCSSAA, which is the Association of Alberta. And we received some funding, and we funded 14 communities were funded for their estimation. 5 were self-funded. We also had Kainai First Nation as part of this whole project, and we call this the 20 communities estimation project. Essentially, Spruce Grove and Stony Plain partnered together to be part of this estimation project, and we'll be presenting, giving you an outline of what their experience was using the guide, how they used it, and what kind of data they were able to gather that was missing in their community. And they will present on the preliminary results. So this estimation just got completed, and we are currently in the process of analyzing and doing all the research. But there's some preliminary results that Sharida and Lynn are going to present. So to conclude my piece, this guide has been developed for rural Canada, not for Alberta. It is now free to download from our website in English and French. And if you need any kind of support, you can always contact us. ARDN helps communities customize the surveys and provide basically overall support, which we've learned that a lot of communities need. So we have actually created, initially the idea was to just create a free guide for communities to use, but we've had requests where people needed help, so we have started providing help to communities as well. Sheridan, you guys want to take it from here?
Thank you, Zane. Thank you very much. Just a reminder, as I'm passing it over to Sharida and Lynn, I invite anyone who has questions to type them into the question dialog box at any time during the presentations, and we'll get to them at the end of the webinar. Thank you, and over to you, Sharida and Lynn.
Hi, so just wanted to check, do you see our screen right now?
We do, thank you.
Okay, well, thank you, Zane. Again, my name is Lynn Bossman. I'm a case manager with Spruce Grove FCSS, and I'm here with my colleague, Sharida Chilag, a community development coordinator with Stony Plain FCSS. So we are pleased to be here today to share a little bit about our successes and challenges with our community's homeless estimation project. In the fall of 2018, our tri-region area of Spruce Grove, Stony Plain, and Parkland County completed the Rural Homelessness Estimation Project using the Arden step-by-step guide to estimate rural homelessness.
Our community's project spanned over a 6-month period. We started our project in July of 2018, and we are now in the final stages in the data cleaning and analysis, and will soon be releasing our full community report. We feel that the 6-month timeline as presented here was sufficient for successful implementation. We took the time early in the project to win over our community support and establish strong community partners. This involved informing our community of the project, the rationale for this project, and its positive benefits to our entire community. After gaining an understanding of the project, our partners had to consider first whether there were any organizational constraints that would not allow them to participate, and second, whether they could modify their workflow to incorporate the survey with minimal impact to their services. We found that partners were not only willing to participate, but also very cooperative and creative in incorporating the survey into their workflow. There are some challenges, however, for participation. For example, Alberta Health Services was not able to come on board in our community despite their interest due to Privacy and Alberta Health Information Act restrictions.
We believe that partnering with community agencies was integral to our project's success. Our partners included Alberta Works, Braden Institute, Native Counseling Services, NeighborLink Parkland, County Libraries, the Parkland Food Bank, Primary Care Network, 3 local FCSS offices, Alberta Parenting for the Future, and 2 MLA offices. The partners recognized the value of collecting data on homelessness and service needs, and were motivated to participate in a project that would provide our community with data and allow us to improve our community services. Each partner identified a lead for their project that would take the training and bring information back to their organization.
An important step in our process was to train our partners. In the month prior to the survey period, we invited all partners to a lunch and learn training session. We reinforced the project purpose, explained standard definitions required to understand the survey, outlined the pre-survey steps, provided a pre-survey script with required disclosure information, explained the unique identifier process and the importance of safeguarding personal information. This session not only provided required information, but also encouraged community collaboration. It brought together new partners and created new pathways of collaboration in our community.
We used 2 data collection methods in our project. The first method was to ask residents of the tri-region to complete a survey at one of the partnering agencies over a month-long period. We marketed this method by distributing brochures and posters and by utilizing social media and electronic billboards. The second data collection method was a known location count. We handed out individual invitations at 3 locations where residents were known to be precariously housed. We invited these residents to an evening event where volunteers were available to complete the surveys.
Throughout this project, we were very cognizant of recognizing our partners and their valuable contributions of time and energy that made this project possible. We kept them engaged and well rewarded by feeding them weekly with both cookies and data. We would visit each location on a weekly basis to offer support and gather survey feedback. We also sent out weekly snippets of live data so they could see the value of the work they were doing. We originally thought the electronic version of the survey would be preferred due to the easy guided flow. However, we were surprised by the fact that most people preferred paper surveys. They also preferred to complete the survey independently. Because of this, it became evident that the survey and process has to be as simple and clear as possible. Simple language, straightforward, clear questions, clear instructions, and a friendly survey flow. We found that if people were challenged by a question, Rather than asking for help, they would simply skip the question or take a guess. On the positive side, we found that people really liked sharing their information and wanted to provide us with more details, especially around the areas of what services and supports they needed.
Project supports. The implementation of the project went very smoothly. Arden's step-by-step guide was a very comprehensive and understandable document. It enabled us to move forward in a confident manner when we were engaging our partners. Arden and FCSAA provided exceptional support and guidance. They were very accessible and their response was always timely and positive. Arden provided a software platform to conduct the surveys and collect the data electronically. This software allowed us to access ready-made reports, filter data in a variety of ways, and to access live information throughout the survey period.
We enjoyed a bonus positive outcome of relationship building. The survey provided us with an opportunity to build our relationships with people at risk of homelessness. Our known location count provided us not only with an opportunity to connect, but also to build trust and share resources. At the known location count event, residents shared that they wanted more of these types of events and that they felt more included and supported. They felt their voices were being heard. After the event, we know of at least 6 people who felt comfortable enough to access case management supports in our offices for the first time.
At this point, we would like to share some of the preliminary data collected through this project. We collected 260 surveys. 219 adults identified that they were at risk of homelessness, and 10 adults identified that they were without shelter. Children. Data on children was not directly captured through this survey as only clients over the age of 18 participated. 104 people who identified that they were at risk of homelessness lived with children. From this indirect data, it can be inferred that 221 children in our community were at risk of homelessness. Children made up 38% of the at-risk of homelessness population.
67 men and 141 women reported being at risk of homelessness. 2/3 of the people surveyed who were at risk of homelessness were women. 5% of those at risk of homelessness identified as gay, lesbian, bisexual, or other. In general, the percentage of women at risk of homelessness was greater in the younger age groups under the age of 45, whereas the percentage of men at risk of homelessness was greater over the age of 45. Men were 4 times more likely to be unsheltered than women.
Reasons for housing instability. 43% of the respondents preferred not to disclose the reason for housing instability. The primary reasons of housing instability included 46% reported low income as their primary reason, 14% cited job loss as their primary reason, and 8% reported conflict as their primary reason.
73% of those surveyed reported that the primary reason that they were accessing supports was for basic needs. This aligns with the fact that 73% of the surveys were completed by clients of our local food bank. After basic needs, 26% of those surveyed were seeking financial services. Of these, the top financial needs identified were housing and education.
Some of the outcomes we achieved were: we raised awareness of the state of poverty in our community. We provided people living in poverty with a voice. We increased community partnerships. We established baseline for tracking progress in reducing poverty. And we will be able to share valuable data with our entire community. Thank you.
Thank you very much, Lynn and Sharita and Zane. So we'll now open the floor to any comments or questions that the audience may have. I know a couple have come in already. Just to remind everybody, if you do have questions for Zane, Lynn, or Sharita, please type them into the question dialog box, and I will ask our presenters to answer those. So as I'm waiting for other questions to come in, I'll ask the first couple. So specifically to Arden, what are some of the other communities outside of Alberta that are have either used the guide already or are using the guide, and have any of them finished the process? Like, are there any results available?
Yeah, the communities outside Alberta are still working on it. So we've heard a couple of communities in BC are applying this. And we are right now talking to organizations in Ontario to actually promote this guide. We do not have results as of yet for anything outside Alberta.
Okay, thank you. So the next question is something that I'll be able to answer. It's where can we find copies of these presentation slides afterwards? So response to your question, Lori, is we'll actually have them posted on the CHRA website probably by tomorrow, if not then early next week. Her follow-up question was, would the speakers be able to provide their speaking notes? So Lori, the actual webinar is recorded, so you'll be able to hear this entire presentation again. You can always contact the speakers. I think they provided their contact information in those slides as well to ask any specific questions about their presentations. So this question's open to all speakers. I'll let you unmute yourself if you'd like to answer. Maybe we'll start though with Sharita and Lynn, just because you guys have just gone through this process. So in your process and your creation of the surveys, was Indigenous heritage also collected during the counts? And if not, why? If yes, what was the approximate representation of Indigenous people within the counts?
Yes, definitely. Indigenous was one of the identifiers that were in the survey. We didn't have any of the data in our presentation here, although we are collecting that data. I don't have my actual report right in front of me, so I can't give the numbers. Can you remember, Lynn?
No.
Is this something that people will be able to email you to ask about?
Absolutely, yeah, and we'll be able to share our full report once it's being able to release.
Fantastic, thank you. So the next question that has come up is it possible to predict where these homelessness numbers are going? I'm not, maybe you guys understand what the question is asking, but I think what the question is trying to ask is whether they're going up. Is that, please correct me if I'm wrong,
Yeah.
a participant who asked, but go ahead.
So I just have a comment on that. So essentially, you can know what the numbers look like and what the trends look like over time. So again, there's a lot of data available, so this is just a starting. But over years, we would be able to essentially tell where the numbers are going, what the trends look like, which of the different like issues are like concerned in those communities and any community and across Alberta or Canada, right? Over time. Okay,
thank you. And I guess the follow-up to that was what is homelessness like in rural communities? And I'm assuming this data or this, and I know these are a lot of these counts are just the surveys are just in the beginning stages, but we'll be able to see a little bit better in regards to what homelessness looks like in rural communities and whether it appears more visible in urban areas, which it does, and what that means.
So maybe Lynn and Sharda can talk about what they've seen. On our end, right now, what we're doing is we're developing we're compiling all the data that we've gathered from the 21 Communities project, and we're developing a report to basically show all these communities were in Alberta, right? To show what basically homelessness looks like in rural communities in Alberta. And Sharda, then you can talk about your personal what you've seen.
Yeah, we're finding that the data that we're collecting is really quite interesting. Again, it is just a snapshot. This is the first time we've done it. So as we continue to do it every 2 years, we will start to develop those trends specific to our community and maybe even across Alberta. But the data's, we're able to see, you know, a little snapshot of what homelessness looks like in our community. We can tell what type of housing people are living in, what are their reasons for instability, what are their service needs. We're able to take this data and we're able to compare it, data across different age groups, data against different genders. We're able to see family demographics, how many single parents versus family units, and things like that. So the amount of data that we're getting from this report is really quite detailed, and we're very excited about moving forward with it.
I think the other important thing with the survey is that there's the common definition of homelessness now, from community to community. And when we're presenting our report, people that are reading it are understanding what homelessness is by the definition provided, which includes other communities, council, you know, just people in the community reading it. So
I just want to mention that if you guys are interested in following up and learning more about where we are, what's happening, what are the results, I would suggest you guys to register to our newsletter. And essentially what will happen is when all these communities start releasing press releases, we are going to start posting that stuff on our website. So you will get, you will be able to see it on our website and on newsletters as well.
Thanks. So I have another question coming in around point-in-time counts and whether they were used at all in the 3 community projects that you mentioned. And I think you said that there was the comparison in Rocky Mountain House between point-in-time and an estimation. And so the follow-up to that is, if so, what was the reaction from the people being counted in rural communities?
I don't understand, like, what was the reaction from the people who were surveyed?
Yeah, how did people, so people who were actually being counted or surveyed, what was their reaction to that? How did they, yeah,
that's a little difficult to answer, but I will have to actually find that out. But I would assume, I do know that they explained them the purpose, right? What the purpose was. And, like, I wouldn't be able to answer that question.
Okay. I encourage people to continue typing in their questions. We still have some time for questions for Zane, Sharita, and Lynn. So if you have anything you'd like answered, please type it in the question dialog box. In the meantime, I'll ask something of Sharita and Lynn. And I know as I was writing this question, you were actually changing the slide to talk about your unforeseen positive outcome of relationship building, but I was wondering if there was other unforeseen positive outcomes that came through this the estimation process.
I think a big one was just the collaboration of community partners who normally haven't worked together on different projects, and bringing them all together and having that mutual beneficial project that everyone could work on. It created a really good community feeling in our community. So on both within the partners and then within the clients as well.
Great, thank you. So I currently don't see any other questions coming through. If anything pops up while I'm speaking slowly right now, I will definitely ask those questions of you. I'd like to thank the 3 presenters for taking the time to present this topic to our participants today. And I'd also like to thank the audience for participating. Like Zane said, you can access the guide on ARDN's website. Oh, I do see a question, and it's actually it could be to Lynn and Sharita. So is this something that should be run through the FCSS in all of Alberta?
I mean, it's hard for us to be able to speak for FCSAA. It would be a lovely thing for everyone across Alberta to run. We found a lot of benefit for it in our community. I think the more communities that do it, the better the results, and the better the results for everyone will be.
Thank you. All right,
Just
so
to add to that,
go ahead.
sorry, I just want to add to that. So the Conklin one was actually done by a community association rather than FCSSA, and went really well. And the Rocky Mountain House one was done by an emergency shelter, like led by an emergency shelter. So essentially, anyone can lead the charge.
Okay, but the importance is that the entire community is or as much as the community as possible is on board and the partners are there, correct?
Exactly.
Well, thank you. So that's all for questions. And like I said, or as I was saying, thank you to the audience and thank you to Zane, Lynn, and Sharida. Today's webinar recording and presentations will be shared on the CHRA's website in the coming days. You will also be emailed a survey about today's webinar, which will help us here at CHRA with future webinar programming. If you want to hear more from fantastic speakers like Zane, Lynn, and Sharida, be sure to register for CHRA's e-newsletter, which provides information about upcoming webinars. We also encourage you to register for CHRA's 51st National Congress on Housing and Homelessness, which is taking place in Victoria, British Columbia, April 2nd to the 4th this year. Early bird registration closes on February 6th. Well, that is all for today, folks. Thank you again and enjoy the rest of your day.